Recommendations to minimize COVID-19 transmission. Case study, a restaurant. In this video, we will show you how to assess and manage the risk of COVID-19 transmission in a restaurant. The COVID-19 virus is transmitted via 3 routes, essentially through aerosols, droplets, and to a lesser extent through contact with contaminated surfaces. The level of transmission risk depends on a combination of 5 factors: ventilation, safety distance, use of face mask, exposure time, and relative humidity. The combination of these factors and whether or not they are managed correctly influences the transmission risk level, which can be low, medium, or high. In the next few minutes, we will show you the risk map of a restaurant and examples of situations where there is a risk of COVID-19 transmission due to the poor management of the 5 factors mentioned. These examples consider droplet and aerosol transmission of the virus, as they are the most common transmission routes and present situations of maximum risk. Furthermore, they will help you learn about the most appropriate preventative measures in terms of ventilation, safety distance, use of face mask, and exposure time. With regards to relative humidity, this should be kept between 40% and 60% in all instances by using air conditioning, humidification, and dehumidification systems. Let us now take a look at these high-risk situations of COVID-19 transmission and the recommended preventive measures in each case. Risk Node 1 Dining Room. This is a small restaurant, and it does not have windows that can be opened. Although it does have air conditioning, it is only turned on when customers are present. The restaurant is in a place where it is not possible to have outdoor seating. As a small restaurant, they try to make the most of the available space so the safety distance between tables is not always respected. When there are no customers on the premises, employees remove their mask. Customers also remove their mask as they settle at their tables. They usually spend around an hour and a half having lunch or dinner at the place. Recommendations to reduce transmission risk. Keep the doors open and turn the air conditioning on in full extraction or maximum extraction mode, allowing the greatest possible air renewal and avoiding its recirculation. Ensure 2 meters between tables. Ideally, accommodate diners by preventing the airstream from flowing directly from one table to another. Communicate and control the maximum capacity allowed according to each space. Provide your employees with N95 type face masks without a breathing valve, and enforce them to wear a face mask all the time, with or without customers in the restaurant. Ask clients to wear their face mask whenever they are not eating food or drinks, even when sitting at their table and when they move. Reduce as much as possible the time staff stay in contact with clients. Risk Node 2, Takeaway and Delivery Service. Delivery service staff and customers wait for their order to be ready inside the restaurant that lacks adequate ventilation. It is difficult to maintain the safety distance at all times. Some couriers remove their mask while waiting, especially when there are no clients. In addition, delivery staff return to the restaurant between orders to save time. Recommendations to reduce transmission risk. To reduce transmission risk, follow the recommendations for ventilation, safety distance, face mask usage, and exposure time provided for the dining room. Furthermore, ask delivery companies for their plan to prevent COVID-19 and check that their preventative measures comply with this series of recommendations. Encourage delivery personnel to apply preventative measures in the restaurant and during order delivery. Encourage delivery personnel and clients to wait for their order outside the restaurant. Ideally, there should be a window facing the outside to facilitate contactless pickup. Risk Node 3, public restrooms. The restaurant's restroom is not ventilated. The total space area is about 6 square meters. Although one cannot control who wears a mask inside, it has been observed that many users put their mask on again when they are leaving the restroom. In general, users spend 5 to 10 minutes inside the restroom. Recommendations to reduce transmission risk. Install ventilation, for example, a grill or extractor fan that circulates air. For hygiene and as a precaution, the toilet should have a lid. Instruct users to close it before flushing. To avoid spreading infectious particles on paper towels, place bins with a lid and an inner bag. Communicate and control the maximum capacity allowed so that the safety distance can be maintained. Encourage users to keep their face mask on while inside the restroom. Lastly, users should remain inside the restroom for the shortest possible time. The aforementioned measures are aimed at minimizing the risk of droplet and aerosol transmission. Furthermore, with regards to transmission through contact with infected surfaces, it is recommended that waiting staff are assigned different roles, with some responsible for collecting dirty dishes and cutlery, and others responsible for serving orders and providing clean cutlery. If there are not enough staff, it is essential that servers sanitize their hands between different actions. It is also important to facilitate hand sanitizing among staff and users with soap, water, and single-use hand towels. Empty waste baskets daily, and keep the facilities in a clean and hygienic condition. This video only shows a summary of the most relevant recommendations for high-risk situations. There is a specific tool available to help you carry out a personalized risk assessment for your establishment. You will be given the most appropriate preventive measures to implement in each case, depending on the result of your risk assessment. We encourage you to learn more about this tool at www.iadb.org/tourism protocols.